A lot of people ask us, how will Allurion gastric balloon affect my snoring or sleep apnea? See, if you are losing weight, your snoring and sleep apnea has to improve. There is no negative effect. So once you are start losing weight, your snoring will improve and your sleep apnea will also improve. But if you have a severe sleep apnea, we have to discuss with you whether you need Allurion gastric balloon or you need some other procedure, because since you will use BiPAP in the night, there is a balloon in the stomach, you can feel some discomfort. That has to be discussed on case to case basis. But in other patients who have early sleep apnea or who have snoring only, after the procedure, because of the weight loss, your snoring and sleep apnea will definitely improve. Thank you.